like to speak on my bill just to save everybody time. I'll just explain it publicly.
Sure.
Last week on Friday, I was listening to the news and I heard about a memo to the police about what they should do with a supervised safe injection site. First time I heard of this. Over the weekend, I learned that there is a site in mind, and by the beginning of this week, there was an address. And the judge's order was finalized Tuesday evening, and by Wednesday, Safe House announced that they were operating the following week. People find it incredible, unbelievable that council did not know anything about this. They're very doubtful. How could my council member not know that this was happening? And one of the reasons is because this was done very secretly. I believe it was done intentionally so that the public could not have input. And what happened is it was done through an existing portion of the code because the location is St. Agnes Hospital. What I am saying through this bill is there is no such thing contemplated in the Philadelphia Code. There has never been, until that order was finalized, the idea that a location would invite and rely on people, patients, bringing illegal drugs with them, the content of which nobody knows. Fentanyl, rat poison, nobody knows what's in there. To come on premises and inject themselves under medical supervision, but leave at will, regardless of their condition, whether they're going to walk across the street or get in a car and drive. The community, so for whoever is in favor, who supports safe injection sites, whoever opposes, I think generally people would agree that it's just shocking that this site is opening a week after the federal order without any hearings, information, or knowledge to the public because it is going into an existing health facility. What I'm saying is that type of health facility, it's never been done in this country. It is uncontemplated in the Philadelphia Code, and therefore I've introduced a section of Title VI, the Health Code, in Chapter 6, which is a section that deals with identifying nuisance health establishments by stating that unless a process established under Section 3 is followed, a supervised injection site is presumed to be a nuisance health establishment because it relies on drug-addicted individuals bringing illegal controlled substances into the health establishment to consume on premises and depart at will, regardless of their condition and safety of themselves and the public. Any plan to operate a supervised injection site shall be publicized to every resident, business, and institution within a 1-mile radius of the proposed location at least 6 months prior to the planned operation of such a site. The proposed supervised injection site shall provide a detailed plan of operation to the residents, businesses, and institutions 3 months prior to holding a public hearing. The hearing must be held at least 3 months prior to the planned date of operation. The proposed supervised injection site may not operate without approval of 90% of the residents, businesses, and institutions within the 1-mile radius of the facility. And if criteria A through D are satisfied, then City Council shall vote to approve or disapprove the operation of the proposed supervised injection site unless its operation is already determined to be in violation of the Commonwealth or federal criminal laws, in which case such facility shall not operate. Thank you.
Thank you, Councilman.